Learning new information tonight on the impact of COVID and staffing shortages at local hospitals. We've known many hospitals are struggling with more patients and fewer staff, but the WCPO 9i team has learned which hospitals have been at capacity and for how long. Chief Investigative Reporter Craig Cheatham joining us live in the newsroom right now with what he's learned. Craig,
in response to our request, the Hamilton County Communications Center provided this list of Southwest Ohio hospitals that have been at capacity during the last 2 weeks. At least 7 hospitals in Butler, Hamilton, and Clermont counties have been at capacity during the first 2 weeks of this year. The COVID surge had a big impact on the University of Cincinnati Medical Center, which was at capacity for part of each day from January 1st through the 5th, up to 16 hours a day at capacity. The WCPO 9i team has followed local EMS crews and dispatchers during the pandemic as they try to provide the best service possible under extreme conditions.
Medic 279.
Medic 279.
Confirming UC on diversion, correct?
That is correct.
West also, who else?
Diversion is a word sometimes used to refer to hospitals at capacity but are still accepting the most serious cases. At least 3 hospitals in Southwest Ohio were at capacity on the same day, on January 2nd, 3rd, 5th, 10th, and the 11th. This week has been particularly challenging at Mercy Health Clermont Hospital, which was at capacity for part of each day from January 10th through the 14th. Including at least 27 hours at capacity during the last 2 days. According to the Hamilton County Communications Center records that we got, the University of Cincinnati Medical Center was at capacity 20 times during the first 2 weeks of the year, ranging in periods lasting as little as 20 minutes to as long as 8 hours. Live in the newsroom, Craig Cheatham, WCPO 9. I-team.
All right, Craig, thank you. And what some field crews there called diversion, hospitals call it at capacity. Anchor Kristen Hartman spoke with someone from the Health Collaborative to better really understand, what that means for you at home or a loved one who might need emergency care. Kristen?
Craig, the at-capacity designation allows for proactive load balancing across hospitals. So if one facility says it's at capacity, the notification goes out and other places with staff and space can prepare for paramedic crews who are transporting patients accordingly. It allows the facility under duress to take a breath and continue to provide care. But it is a simplistic explanation of a complicated situation made more serious by the fact we have more than 1,000 COVID patients in our area's hospitals right now.
We broke 1,000 this morning.
At the Health Collaborative, Tiffany Mattingly tracks what's happening at the hospitals in your region. Right now, COVID care, seen here via Zoom, has stretched facilities.
Yes, this is the most stretched I've seen the hospitals in my experience in this position.
So in the name of across-the-board care, she says those hospitals and EMS crews bringing patients in have to be situationally aware. And that's where at-capacity communication comes in. Tiffany says the designations are at an all-time high.
Is it a staffing thing? What is it?
Staffing is the greatest issue right now. The healthcare employees are not immune to COVID. They are just as susceptible as everyone else.
She says an at-capacity designation gives a hospital time to work through existing cases for a few hours, keeping in mind it would not say no to critical conditions like stroke and heart attack. But what about other emergent care?
Is there a tipping point where you have to worry about being taken care of if you have an emergent situation?
It's a really tough question.
Tiffany tells me they flex the best they can. Patient load is one reason you see some National Guard help now.
The important thing is that if you need medical care, urgent medical care, the emergency departments are open, they are safe, and they are ready to care for you.
But if it's not chest pains or shortness of breath, if you really don't have to go to the ER, don't. Need a COVID test? Start with Test and Protect for a full list of sites. And keep this in mind, with the Bengals' success, this is an exciting weekend for everyone. but it is a worry for healthcare providers. Do what you can to stay healthy. Symptoms? Do not go to that watch party. Going to a gathering? Mask up. It is the least you can do, they say, to try and give hospitals a break.